Stroke is the leading cause of long-term disability in the United States and the fifth leading cause of death. Every year, more than 795,000 Americans have one. That is one stroke every 40 seconds. But here is the part that changes everything. In a significant number of cases, the brain does not just shut down without warning, it sends distress signals, hours before, sometimes days before. Specific, recognizable, measurable signals that tell you exactly what is coming. The problem is that almost nobody knows how to read them. They are subtle, they are brief. They appear for a few minutes and then vanish completely. So people talk themselves out of taking them seriously. Must have been nothing. I was just tired. It went away on its own. That decision, that moment of dismissal, is where the real damage begins. Because your brain just handed you a window. A narrow window, roughly 48 hours, where the disaster that is building inside your blood vessels can still be intercepted. Miss that window, and you are looking at emergency rooms, brain damage, paralysis, or worse. What you are about to hear is the information your 12-minute office visit does not leave time for. The system is not built to walk you through this. So let's do it right here. Before the warning signs make any sense, you need to understand the event itself. Because stroke is not one thing. It is two very different emergencies happening in the same organ. The first type is an ischemic stroke. A blood vessel in the brain gets blocked. Blood flow stops. The brain tissue fed by that vessel begins to die. This accounts for roughly 85% of all strokes. It is the type that tends to announce itself before it arrives. The second type is a hemorrhagic stroke. A vessel does not block, it bursts. Blood pours into or around the brain, compresses the surrounding tissue, and the damage is immediate and often catastrophic. To understand why every minute matters in either case, you need to appreciate how demanding your brain actually is. It weighs about 3 pounds, roughly 2% of your total body weight. But it consumes around 20% of the oxygen you breathe in and about 25% of all the glucose circulating in your blood. It is a control center that never shuts off, and it requires a constant, uninterrupted fuel supply. Cut that supply for even 4 to 6 minutes, and brain cells begin dying. Not struggling, not weakening, dying. And unlike a torn muscle or a broken bone, dead brain tissue does not regenerate. It does not heal over time. What is lost permanently. Speech, movement, memory, independence. That is why doctors call stroke a race against time. It is not a metaphor. It is literally a race to restore blood flow before the damage becomes irreversible. And that race does not start in the emergency room. It starts the moment your body sends you a warning, if you know what to look for. Most people picture stroke as a lightning bolt. You were fine, then you were not. Random, unpredictable, out of nowhere. That is a myth, and it is a dangerous one, because it makes people feel powerless. If stroke is random, there is nothing to watch for, nothing to prevent. You just hope it does not happen to you. Here is the reality. For a brain artery to suddenly block, the groundwork usually took years. The walls of that vessel were being damaged slowly, silently. Cholesterol deposits were accumulating layer by layer. The opening was narrowing millimeter by millimeter. This is not an explosion. It is the final step of a long, predictable process. And along that road, your body almost always sends a warning. In medicine, that warning is called a transient ischemic attack, or TIA. Transient means temporary. It comes and it goes. Picture what happens. A carotid artery, the main vessel carrying blood from your heart up to your brain, has been narrowing for years. One day, the already tight passage spasms briefly, or a small clot forms on the plaque surface. Blood flow to part of the brain stops for a few seconds or a few minutes. You experience a stroke symptom. Then the blockage clears, flow returns, and the symptom disappears. You feel fine again. So you move on with your day. That is the mistake. Clinical data shows that a TIA frequently precedes a full stroke, often within 48 to 72 hours. Those 2 to 3 days are your window. The brief, strange episode that went away on its own was not a glitch. It was not fatigue. It was not bad luck. It was your brain firing its last warning flare. And most people never take it seriously until it is too late. You are standing in your kitchen. You turn your head and suddenly one eye goes dark. Not both. One. It is like someone pulled a curtain down over that eye, or smeared the lens with gray mud. You blink. You rub the eye, and within seconds, maybe a minute, your vision comes back, completely normal. So you blame it on standing up too fast, or too much screen time, or just one of those things that happens with age. It is none of those things. What actually happened is this. A tiny clot or a small fragment of plaque broke free from the wall of your carotid artery, the main vessel running up through your neck toward your brain. That fragment traveled upward and briefly plugged the ophthalmic artery, the artery that feeds your eye. The ophthalmic artery is not some random isolated tube. It is a direct branch of the internal carotid artery, the same vessel that supplies your brain. When the fragment wedged into that tiny artery, your retina, the light-sensing tissue at the back of your eye, lost its blood supply. You saw darkness. When the fragment dislodged and blood flow resumed, your vision returned, and you felt lucky. You were lucky, because that exact same fragment could have traveled 2 millimeters to the side into a brain artery, and instead of a 1-minute blackout in one eye, you would be looking at permanent loss of speech, paralysis, or death. Doctors call this episode amaurosis fugax. It means fleeting blindness. Neurologists treat that phrase like a fire alarm. When a patient describes it, they get urgent evaluation immediately, because the next event may not be in the eye, it may be in the brain, and it may not be temporary. You are sitting at the table eating dinner, nothing unusual, and suddenly your left hand feels strange, tingling, pins and needles, like the skin is turned to rubber, or your right cheek goes numb, as if someone injected Novocaine into half your face. It lasts a few minutes. Then it fades. Sensation comes back completely. You flex your fingers, touch your cheek, everything feels normal again, so you shrug it off. Probably slept on it wrong. Probably a pinched nerve. Here is how to tell the difference. When you sleep on your arm and it goes numb, that is nerve compression. You squeezed a nerve with your body weight. Blood flow was restricted, and as soon as you shift position, feeling returns. The cause is mechanical, and it is local. Your brain is fine. The problem was in the arm. A TIA-related numbness is the opposite. The arm is fine. The problem is in the brain. Specifically, it is in the brain region that maps sensation for that body part. When blood flow to that region drops for a few minutes, the area responsible for processing feeling from your hand, your face, or your entire left side temporarily goes offline. You feel numbness, but the origin is not where you feel it. It is inside your skull. There is one detail that makes this distinction even clearer. Stroke symptoms are almost always one-sided. Your brain is divided into two hemispheres, and each hemisphere controls and processes sensation from the opposite side of your body. When both hands go numb symmetrically, that more often points to a spinal issue or a nerve problem in the neck. But when numbness appears suddenly on one side only, without any obvious mechanical cause, and resolves on its own within minutes, that is a pattern neurologists take very seriously. That is not a pinched nerve. That is your brain telling you it just lost blood flow, briefly, and it may lose it again permanently. You have now heard two of the warning signs your brain sends before a stroke: fleeting blindness in one eye, sudden one-sided numbness that vanishes on its own. Both easy to dismiss, both critically important. So here is the question I want you to sit with for a moment. What are you going to do with this information? Because I can tell you what most people do. They watch, they feel concerned, they tell themselves they will bring it up at their next appointment, and they go back to their evening. Nothing changes, no action gets taken. As a physician, that is the part that frustrates me most. Awareness without action does not protect you. Knowing what a warning sign looks like means nothing. If you are not connected to the right care before an emergency makes the decision for you. That is why I want to tell you about Care Health. It is a free platform that matches you with healthcare options in your area, specifically things like stroke and cardiac screenings, blood pressure monitoring programs, and clinical trials for cardiovascular disease. You fill in a short form, date of birth, gender, a couple of basic questions. It takes 30 seconds, no cost, no commitment. Care Health simply matches you with relevant options near you so that when you need them, they are already there. Click the link in the description or point your phone camera at the QR code on screen to scan it directly. 30 seconds now could save you from making critical health decisions under emergency pressure later. That is not a sales pitch. That is how preventive medicine works. Now let's continue, because the next 3 warning signs are the ones people miss most often. You are walking across your living room, a floor you have crossed 10,000 times, and out of nowhere your foot lands in the wrong place. Your leg feels rubbery, like it forgot how to hold your weight. You stagger sideways and grab the back of a chair. Or worse, a violent spinning sensation hits you so hard that the entire room tilts and you reach for the wall just to stay upright. You were not spinning. You did not jerk your head. You did not stand up too fast. It came from nowhere, and it left just as quickly. Here is what happened. The part of your brain that keeps you balanced and coordinates smooth, precise movement is called the cerebellum. It sits low in the back of your skull, like a small secondary brain. It constantly calculates where your body is in space, how hard each muscle should fire, and how to keep you walking in a straight line instead of zigzagging. The cerebellum gets its blood supply through arteries that run up through the bones of your neck into the back of your head. Doctors call this the vertebrobasal system. If blood flow through those arteries drops sharply, even for a few seconds, the cerebellum essentially glitches. That is when you suddenly veer sideways, misstep on a flat surface, or feel a spinning sensation so intense it forces you to sit down. And here is the pattern I see in practice, over and over. People explain it away. Bad shoes. I was tired. Must be my blood pressure acting up. They find a comfortable reason, and they move on. Benign dizziness usually has a clear trigger. Rolling over in bed, turning the head quickly, a known inner ear condition. But spontaneous, intense dizziness combined with any difficulty walking straight with no obvious trigger should be treated as a possible TIA until a doctor rules out a vascular cause. That is not overcaution. That is the correct medical response. Before I describe this one, I want to be clear about what it is not. Forgetting your neighbor's name. Blanking on a word that was right on the tip of your tongue. Losing your train of thought mid-sentence because you are tired or distracted. That is normal. That happens to everyone, at every age, and it is not a stroke sign. What neurologists worry about is something entirely different. A sudden dramatic breakdown in speech that makes even you feel that something is seriously wrong. Your brain has two main areas responsible for language, both typically located in the left hemisphere. The first, often called Broca's area, handles forming words and sending instructions to the muscles of your tongue, lips, and jaw. When that region loses blood flow, you can understand everything being said to you. You know exactly what you want to answer, but you cannot get the words out. They come slurred, stuck, chopped into fragments. Your mouth will not cooperate with your mind. The second area, often called Wernicke's area, handles comprehension and organizing your sentences so they make sense. When that zone is in trouble, you may speak fluently, confidently even, but what comes out is complete nonsense. Word salad. And you may not understand simple phrases directed at you, even though you hear them perfectly fine. If either of those patterns appears suddenly out of nowhere and then fades within a few minutes, that is textbook TIA. It is not exhaustion. It is not stress. It is not just one of those things. Think of it this way. Your home alarm goes off in the middle of the night. It screams for 30 seconds, then stops on its own. Everything is quiet again. Do you roll over and go back to sleep? That is exactly what people do when their speech breaks and then returns to normal. They decide it was probably nothing. It is not nothing. It is your brain telling you the blood supply just failed briefly, and the next failure may not reverse itself. Everyone gets headaches, tension after a long day, dehydration, poor sleep, a shift in the weather. You have had dozens, maybe hundreds of them in your lifetime. You know what your headaches feel like. You know their rhythm, their intensity, their usual triggers. This warning sign is not about those headaches. This is about the headache that arrives and immediately feels wrong, different, a sudden severe pain that peaks within seconds, not the slow build you are used to. People who experience it almost always use the same phrase when they describe it to a doctor. The worst headache of my life. That phrase is one of the most important sentences in emergency medicine. Because a sudden explosive headache with no clear trigger can signal a hemorrhagic event, a blood vessel in the brain that is leaking or on the verge of rupturing. It can also signal a vessel in acute distress, spasming or critically narrowed, struggling to deliver blood to the tissue it feeds. Most people do not call a doctor for a headache. They reach for ibuprofen, drink some water, and wait it out. And for an ordinary headache, that is reasonable. But when the headache is new in character, sharper in intensity, faster in onset than anything in your history, and especially when it shows up alongside any of the other 4 warning signs we just covered, that combination demands evaluation. Not next week, now. One more thing worth understanding. Chronic conditions like arthritis in the small joints of the upper neck or a disc herniation in the cervical spine can produce head pain that mimics vascular headaches almost perfectly. The pain radiates upward from the neck into the skull and feels exactly like a blood vessel problem. This is precisely why proper evaluation matters. Numbing the pain with pills without understanding its origin is not a strategy, it is a gamble. And with your brain's blood supply at stake, you do not want to be gambling. Now that you know the 5 warning signs, I want to take you deeper, because those warnings do not appear out of thin air. They are the end result of years of silent damage happening inside your blood vessels. And the source of that damage is not what most people think. The inside of every artery in your body is lined with a microscopically thin layer of cells called the endothelium. Think of it as a non-stick coating on the inside of a pan. When that coating is smooth and intact, blood flows through cleanly. Nothing clings. Nothing builds up. But when the endothelium gets scratched, inflamed, or damaged, it becomes rough. And on those rough patches, cholesterol, platelets, and inflammatory proteins begin to stick. They accumulate, they harden. Over years, they become the plaques that narrow your arteries and set the stage for everything we have been discussing. The first major enemy of that lining is chronically elevated blood sugar. You do not need a diabetes diagnosis for this damage to begin. Even pre-diabetic levels glucose that is only slightly above normal are enough to injure endothelial cells quietly for years. Glucose is your cell's fuel, but when there is too much of it circulating for too long, it damages the very vessel walls it flows through. Those damaged zones become rough, scarred landing pads where deposits accumulate and plaques begin to grow. The second enemy is smoking. Cigarette smoke delivers thousands of chemicals directly to the inner surface of your vessels with every inhalation. The result is direct chemical damage and chronic inflammation of the vessel wall. At the same time, nicotine and carbon monoxide make your blood thicker and stickier. Platelets clump more easily. Clots form more readily. A damaged, inflamed vessel wall combined with thick, sticky blood is the ideal setup for a blocked artery. The third enemy is uncontrolled blood pressure. Years of elevated pressure physically stress and weaken your vessel walls. They lose elasticity. They stiffen. Plaque formation accelerates, and here is the myth I want to dismantle. Many people believe that if their cholesterol numbers look normal, they are safe from stroke. That is not true. The condition of the vessel wall matters just as much as what is floating in the blood. Normal cholesterol flowing through damaged vessels still builds plaques. It is not just about what is in the river, it is about the state of the riverbank. If you have experienced even one of those 5 warning signs, even briefly, even weeks or months ago, here is exactly what to do. This is not theory. This is protocol. First, write it down. Right now, while it is fresh, what happened, which side of your body was affected, how long it lasted, what you were doing when it started. Plain language, no medical terminology needed. Bring that written list to a doctor. Do not rely on memory. Under stress, in a clinical setting, people forget half the details. Paper does not forget. Second, ask your doctor specifically about TIA evaluation. Do not wait for them to bring it up. Request 3 tests by name. Carotid duplex ultrasound, which shows both the structure of your neck arteries and how blood is flowing through them, including whether it speeds up and becomes turbulent at a narrowed segment. HbA1c, a blood test that reveals your average blood sugar over the past 3 months and catches hidden prediabetic damage that a single fasting glucose test can miss entirely. And Holter monitoring, a 24-hour heart rhythm recording that detects silent episodes of atrial fibrillation, a chaotic heart rhythm where clots form easily and shoot up into the brain. Atrial fibrillation is one of the leading causes of cardioembolic stroke, and many people who have it feel nothing more than an occasional flutter they blame on stress or caffeine. Third, immediate safety. Do not drive yourself after a suspected TIA. Losing vision or arm control for even a few seconds at highway speed is life-threatening for you and everyone around you. Do not self-prescribe blood thinners based on something you read online. Ischemic and hemorrhagic strokes require opposite treatments, and only brain imaging can tell which type is occurring. No doctor can determine that without a scan, and if possible, do not be completely alone for the next 48 hours. If another episode happens and you cannot speak or move, you need someone nearby who can call for help. This is not panic. This is preparation. There is a difference. Let me bring this together. Your brain sends 5 warning signals before a stroke: sudden blindness in one eye that clears within a minute, One-sided numbness or tingling that appears without cause and resolves on its own. A sudden loss of coordination or violent dizziness on a flat, familiar surface. Speech that breaks down dramatically and then returns to normal. And a headache that is different in character, intensity, or onset from anything in your history. Any one of those showing up for the first time, even if it vanishes in under a minute, is a reason to see a doctor urgently, not next month, not at your next scheduled appointment, now. Stroke is not a lightning bolt from a clear sky. It is the final step of a process that has been building inside your blood vessels for years, and in most cases your brain tells you it is coming. The difference between a devastating outcome and a prevented one is not luck. It is whether you recognized the signal and did something about it. Everything in this video is for your understanding and your education. Your specific situation is yours, and using what you learned here as a starting point for a real conversation with your doctor will always be more valuable than trying to manage things on your own. Knowledge without action changes nothing, but knowledge combined with the right next step can change everything. And remember, that free health screening link is still in the description. 30 seconds could genuinely change what happens next. Take care of yourself.